Do you all see the PowerPoint? Okay, cool.
Yep. Great. And Jen will just give you a verbal notice to advance the slides, but Sarah's going to kick things off for us.
All right, give me 1 second to get my tech set up here. One moment. Yeah, so thank you for having us today. What we'd like to do is just give a really high-level overview of the crisis system here, with the bulk of it being the update around 988. So go ahead and advance to the next slide, please. All right, so since 988 launched in July of 2022, what we've been doing here is implementing both the 988 side, but then also our overall behavioral health crisis system, which 988 we consider to be a part of. For us here, that means that we see 988 and the behavioral health crisis system as having three main pillars. And that includes having somebody to call, somewhere to go, and then someone to respond. Somewhere to call would be the 988 system. Someone to respond includes our mobile crisis teams as well as the MRSS team system. And then somewhere to go is our crisis receiving centers and crisis stabilization centers. Really, we're hoping to provide an integrated behavioral health crisis system here that has both the response in a timely manner and is able to get people care at the right time, and then also get them, the services that they need in the moment. Next slide, please. Okay. This is a visual for everybody here to talk about the Crisis Now framework, which is part of the national model. You can see here that we've got the crisis call center, mobile crisis, as well as, I think that would also imply the MRSS system, which is focused on youth and family, and then getting a crisis response either to a crisis receiving center or crisis stabilization center. We understand that it's not always a linear process, but this is just a high level visualization of how the model is intended to look. We'll be able to go through this a little bit more specifically, but right now Rose is going to talk a little bit more about 988 call centers.
Fantastic. Jen, would you be able to advance the slide? Amazing. So as Sarah really gave us the right frame, right? And this is what y'all have in your hearts and minds. 988 is connected to the overall system, but in order to support that connection, we need a really clear vision for what 988 will offer. So here are the core points that we keep in our hearts and minds as we build out this work. 988 offers a confidential, compassionate, and trained response during moments of crisis. And that can be for individuals who are reaching out for themselves. It can also be for family members, friends, or professionals. I know that many in this group, like this is the work you do every day. And so really the vision of 988 is to be there for everyone who needs it. 988 offers supports for callers of all backgrounds and all demographic groups. And we'll talk a little bit more later in our presentation about some of the specialized services that exist right now. But in terms of overall access, 988 is available 24/7 via phone, text, or chat. So there are multiple modalities that you can reach out to the line if needed. And then language access is available in two different ways. So there are dedicated lines for English and Spanish for both phone, text, and chat. And then interpretation service is available in 250 plus languages. And as of, I want to say, mid last year, a new service launched for callers who are deaf or hard of hearing, where you can actually connect to the crisis line using an ASL video conference platform. So if you prefer to sign instead of to text, that is another access option through the incredible work of some crisis counselors up in the Midwest who provide that service. Beyond access, 988 offers a connected approach to crisis response, and that includes follow-up calls for callers who are at imminent risk, as well as referrals for community resources for those callers that are looking for ongoing support in their local area. Next slide, please. Perfect. And to continue our conversation, I'm going to kick it back off to Sarah.
Thanks, Rose. All right, so talking about mobile crisis intervention services, one thing that's important to note here is that when we talk about mobile crisis, we do specify adult versus youth, and that's that MRSS distinction that I was mentioning earlier. So I just want to call out right now that when I talk about mobile crisis, I am focused more on the adult side of things. We have been working with our counties and CMHPs to implement a 2-person 24/7 mobile crisis response. There's some enhanced requirements that have gone into effect with this. Oh, sorry, thank you, Jill. And we're really aware that, the 24/7 2-person team response is a challenge in some areas due to workforce issues, certainly with population and rural versus urban considerations. We want to work with our CMHPs to develop what makes the most sense, and we have our OARs that have gone to effect around this. So we're working with CMHPs over the next several months here to build out that system, while the rules themselves will go into effect January 1st, 2025. Let's see, can we flow to the next slide, please? All right, here we've got a more visual representation of the MRSS system. This is definitely a vision of how MRSS services would work here. The key difference between MRSS and mobile crisis is that it's the youth and the family who determine the nature and definition of crisis together. I might have Beth or Brian, if either of you want to pipe in and say more, I'd be happy to let you guys say a little bit more about this.
Can't see if Brian jumped on or not. I can just, to add. So one of the things that Sarah was commenting on is that we really are working with our CMHPs, who are the providers of the MRS, of the mobile response, relies on them on the county mental health programs. We're really working with them to sort of shift their thinking about when do we respond to youth and families when they call, what is a crisis, and that the national model really has sort of moved the needle for that and has been really clear about the differences of what is a crisis in a family situation versus for an adult, and really trying to get out there proactively or before the crisis, if even possible. The other thing that is on this slide here specifically is that in the youth model, it's not a place to go, is not the third step. So you saw in the Crisis Now model, they were talking about crisis receiving centers and stabilization centers. For youth, the MRSS model is a system to support, and that looks like an additional 6 to 8 weeks, up to 8 weeks of ongoing services and supports for youth and families immediately following that crisis situation or the response to the home. So that is also one of the huge differences in the two systems. Back to you, Sarah, or Brian. I can't see if Brian had anything to add.
I just threw it in the chat, Beth. I just wanted to echo the low bar and the low threshold for that dispatch to take place with the children and family model.
And then I know we'll have full time for Q&A in the end, but I think we have 2 questions here that we can have Beth quickly answer at a high level. Beth, the questions are from Annette, whether suicide screening is required both at the time of the 988 call and when the crisis team goes out, and if there's an agreed upon protocol, or does each county use their own screening? Do you want to talk to that, and then I'll go over the next question?
Sure. So thanks to this group, actually, the larger alliance, they actually had made several suggestions when writing the rules, and actually was heavily because of your advocacy and the work that you all did with while these rules were getting up and written. We did actually enter into the OARs that there has to be a screening when for every person is screened when the team gets out, whether or not that was what was prompted by the call for 988, because sometimes we know people may not be suicidal or have those thoughts at the time somebody's calling 988, but a lot happens before we get there. So we actually had put into rules that they have to have a screening, and if they can't get a screening, that they document why that was unable for every first response. For stabilization services, we also for the that's for the lifespan. And then also we have to do 72-hour follow-up, where again, we're checking back with the folks. That's for the lifespan. For youth and families, we also then connect them with services within 72 hours. And again, part of those services is a crisis and safety plan, along with working with the youth and family to figure out what services and supports might help them get to the next place.
Perfect. Thank you, Beth. And then Jill had a question about how are either caring contacts or follow-up calls offered, and what do we do on 988 in terms of tracking accountability on that?
Yeah, so that's a great question too. And I just wanted to also add, Annette asked about an evidence base. So we also have incentivized and have provided youth save via the Alliance as well. And through the Big River, we actually had a specific youth save for the mobile crisis workers. And we also have a financial incentive for all the CMHPs to train their staff and youth save as part of their contracts with the OHA. And then also from 988, so for Jill's question, and Jill, the question was around, Dean, can you actually, I lost my train of thought. What was the specific ask? It was about
Jill,
the caring contacts, right?
Feel free, Jill.
Contacts.
In the 988 slide that Rose went over, it said that there was offered follow-up calls for imminent risk of suicide. And I just wondered at the 988 level. And so I wondered about how that determination is made and what's the accountability for that? Like, how is that tracked?
Great. So that's actually a Rose question. So Rose, is there follow-up when somebody calls 988 across the lifespan to do that?
Yes, there is. What I'm going to do is I'm going to look into the details and make sure to follow up with the specifics. But generally speaking, the national 988 line, it's a descendant of the National Suicide Prevention Lifeline. So the policies and procedures that existed as part of that service to make sure that follow-up would happen, and then explain sort of how follow-up should be handled, those procedures still exist and are in place here for Oregon. So thank you for that question. I'm curious if there's a specific kind of follow-up you're most interested in, and I can make sure to research the right answers for you.
I think, Jill, also just to jump in, Rose, is that caring contacts is a specific thing that these folks work with the hospitals around. And I know some of the hospitals contract with 988 to be that person to do the caring contacts. We require mobile response once they go out, also to do a follow-up. We just don't use that language, caring contacts, because I know that means something different for you all when somebody's at the hospital, but it's the sort of the same intent is, are you doing okay? Can we do anything today for you? And so the mobile crisis team also does that within 72 hours for all. So they're trying to reach out to their folks as well after they get to the site. And then Rose, I didn't want to interrupt, but if there are other areas, it sounds like you're asking for the 988 specifically. I don't know if anyone has a specific response for the 988.
Yeah, I think in the interest of time, we'll follow up more. But again, these are the exact kind of conversations I want to reiterate, that it's folks like you all and it's deep understanding of these on-the-ground connections and what are the handoffs that are going to be critical to making the system work. And then I saw Mary has an excellent question in the chat that I'm going to ask Mary if we can wait until the end, because it's a huge conversation about when to call 911 versus 988. So we'll come back to that. So let's go on to the next slide, I think.
All right, thank you. So the last pillar of our crisis system is Somewhere to Go, which we consider to be our crisis receiving and stabilization centers. And fortunately, there's not an ongoing funding stream for this work right now. So we are in phases of building out a future state and working with what we have. The goal with these centers is to provide that safe and secure environment for stabilization, to certainly stabilize in the moment, but then also interrupt the pipeline from immediate crisis to either jail or hospital, and to help those folks return to their community in a safe way. The difference between the two is that crisis receiving centers are 23-hour outpatient facilities, whereas crisis stabilization centers could be up to 14 days. There's, like I said before, there's not currently an ongoing statewide funding stream for this. However, in this recent legislative session, House Bill 5204 did allow for some funding for some specific shovel-ready projects. And some of those included funding for specific counties or agencies to build out their proposed crisis stabilization centers. All right, I will go ahead and pass to Rose again. Thank you.
Thank you so much, Sarah. Jen, would you be able to advance the slide? Amazing. So the next section, this is actually sort of what came in for this meeting's request. How is 988 going? Who is being served? And what can we see from the data available so far? So we prepared information for a few different topics. And the first one we'll talk about is sort of volume going throughout the state. Jen, could you advance to the next slide? Amazing. So you'll see here a graph that shows the two service areas for Oregon's 988 call centers. So in blue, these are the counties served by Alliance for Life, which is the statewide 988 center. They answer an average of 3,500 calls in any typical month, and then 500 texts and 400 chats. As a statewide center, Alliance for Life also operates a number of other lines, including Youth Line, which I'm sure many people here are familiar with, and that really has enhanced sort of like the breadth of service and training available to staff. So it's a pretty amazing partnership to be a part of. In yellow, you'll see the service area for Northwest Human Services. This is our regional 988 partner, and they primarily serve callers in Marion and Polk counties, answering about 300 calls each month. And starting next year, Northwest Human Services is working hard to develop text and chat capacity as well, so that when folks in those areas reach out via text or chat, they will route to their local center and be able to connect via that modality. Northwest Human Services, in addition to answering 988, operates a local emergency rental and financial assistance hotline, in addition to a clinic and to a shelter. So as a regional center, they are primarily focused on connecting callers to direct resources in their immediate area. And again, this is the strength of the network, having so many providers assisting callers in all of these ways. Next slide. So the next topic we wanted to talk about is how the network overall supports callers here in Oregon under 988. So when you first dial into 988, there's actually a few different options that you can connect with. And this slide here shows all of the calls routed from Oregon numbers last year in 2023. A question we get very often is, what's call volume doing? Is it going up? Is it going down? Is it stable? And you can see from these lines, there is variation by month and by season, but across all lines, the volume has been rising. I want to say in the first year of 988, we did see about a 30% rise across all contacts, and most likely by the end of this year, we will be seeing a similar trend. The colors you see represented in orange, this is Oregon 988. In yellow, these are calls that connect directly to the Veterans Crisis Line. The Veterans Crisis Line is one of the oldest crisis services, and it represents roughly 20 to 30% of calls from Oregon numbers who connect directly there to speak with VCL. And then there is an additional service for callers wishing to connect in Spanish, as well as callers who identify as LGBTQIA+. And we will talk more about those services in detail later in the presentation. But for now, you can see the respective share of Oregon volume. Next slide, please. Amazing. So the next topic we wanted to talk about is for calls that do come here to Oregon and are answered in states, what is the breakdown of folks reaching out via phone versus text versus chat? So you'll see in blue is calls, orange is text, and gray is chat. Overall, voice calls are about 82% of the volume we saw last year, and then the remaining is split between text and chat. Something that is so interesting that we see here in Oregon and we see nationally as well is that text compared to chat has been rising steadily over the last half year or more. And we can speculate a lot for the reasons for this trend, but something that we keep in our hearts and minds, especially in messaging and marketing, right, is the more people know that you can reach 988 via text or another modality, the more people will be able to engage with and benefit from the service. There's a lot of folks out there who don't necessarily feel comfortable connecting via voice, and having that extra layer of anonymity and a little bit more time to think through your responses adds an opening for accessibility that we are pleased to be promoting and building in the future. Next slide, please. So another question we get frequently is, who does 988 serve? And so we're looking at this question in two different ways. The first observation we've made in like the first year or so is that we are seeing callers across demographic groups. So callers of all ages, of all races and ethnicities, gender identities, disabilities, and military experiences have reached out to the line across a variety of topics. And then another question that we look at, and we're always observing trends, is who is reaching out? Are people calling for themselves, or are they calling for loved ones in their lives or members of their community? And so in the right, you can see that the majority, it does vary month by month, but right now about 90% of 988 contacts are reaching out for themselves during a moment of crisis. But the remaining 10-ish% is split between people connecting for their family, for their friends, for their children, for their parents, the people in their lives, to get support for others and to build skills for themselves, how to support others. Something that 988 centers when taking calls from, people who are concerned about others, it's important, of course, to address the concerns of the other, but it's also important to care for yourself as a concerned family member, as a concerned friend. And so 988 takes care to provide support for third parties as well. Next slide, please. Another question we get is, what are calls about? And what would a typical call be like in terms of length? So on average, a call can go up to 30 minutes. It can be more, it depends on the nature, but that's sort of how things roll on average. And then for text, about an hour. In terms of reasons for calling, calls come in for reasons under the sun. We collect a couple different categories of the most common reasons why calls come through. And the vast majority, shown in orange on the right, involve mental health, suicide, family relationship, and then a collection of other presenting issues, other concerns that are difficult to quantify. That said, the list goes on. And so you can see in blue a few examples of other reasons that people commonly call, including experiences of depression and anxiety, loneliness and grief, physical health concerns, and a host of other issues, including issues of basic needs, food, and financial assistance, which I think is a good segue to our next slide. So the last question we get frequently is, what types of resources can 988 offer? And I think an important thing to keep in mind here is that for many callers, 988 is a resource in and of itself. That said, about 10% of 988 contacts, and it does vary over time and by circumstance, folks will request resources in their area, ongoing support from organizations in their community. And some of the most common types of resources that 988 will refer people to match right with the slide I just showed. So mental health, substance use treatment, assistance with housing, and financial assistance are some of the most common resource types that 988 offers. On the right, there's a little bit longer list. I know that many people on this call either are educators or have been or know them, and that is a type of resource that does come in here. We do get calls from teachers, etc. There's also resources related to employment, food assistance, insurance, legal support, and many other topics. I'll say two more points that relate to resources and the support 988 can offer calls and sort of how we see trends going. So one is In addition to giving people resources for later, 988 makes an effort to directly transfer callers to resources when it makes sense to do so and when the caller is interested. So 988 does this via warm transfer, either to the local resource itself or to our local county crisis line, who is able to more directly assist people in connecting with help in their local area. And that is something we track. So we don't have the numbers in this presentation, but that's something that has come up previously, is what are we looking at? And that is one of the categories that we track closely. And then the last type of support that 988 is able to connect is for callers who need support in person. 988 works to provide dispatch either through 911 and emergency services, or by working closely with county partners through mobile crisis intervention teams. And that is sort of where we began our presentation, with the work that OHA is doing and the work that y'all are supporting to build out mobile crisis intervention service to extend throughout the state and support any caller who needs it. Next slide.
And with that, Rose, actually, I'll jump in here and answer Mary's question about 988 versus 911. At a high level, we have to remember that 988 is coming up on 2 years old, and all of our counties have had some sort of mobile crisis teams since 2018. But as we know, the pandemic has really exacerbated workforce crises, and our new rules, which are a little higher level of care and requirement, further demonstrate the need to have these 2-person non-law enforcement teams. So as we work on messaging and marketing, and especially as we do more presentations like this and word of mouth spreads about 988, it's important to understand that, as I love the term descendant of the suicide lifeline, 988 in its simplest form is that emotional support. So even though there was messaging nationally and there's been a lot of misinformation about 988 versus 911, folks may have heard it's the mental health 911. We do need to work on changing the narrative, because 911, when you call 911, dispatchers are there to send someone. 988, 98% of the time, the crisis or the emotional support that's needed is fully handled over the phone. And so as we get out messaging and as our counties get more up to speed, that question of who responds, which of course is our #1 concern from many different communities, really depends on the county, and also depends on the level of imminent risk. So this is not messaging for an advertising campaign, but in spaces like this, and as we talk with people about the 988 crisis system, it will be important to help train people to understand, if you are at imminent risk of dying, there are going to be efforts to connect with emergency services. The other big challenge in many of our communities is that bystander effect. So a lot of folks who know about 988 do want to call 988 rather than 911, because what a vision of having a behavioral health response for any behavioral health crisis. And yet you can imagine, if you see someone on the street who is in crisis, you may call 988, or ideally, how do we connect with that individual to get them connected to 988 or their county crisis line? But if someone else also sees that person and they call 911, it is often that emergency services respond more quickly than mobile crisis teams. So that's where a lot of this is really a behavior change and a narrative change, differentiating if you need emotional support, if you want to talk to a trained counselor, 988. But the connection with mobile crisis is going to take many years to fully come to fruition and be the same in every county and for every community. And then I added into the chat that 211 is also a connection we need to make, because our resources that are 988 call centers are only as good as the information that they receive. And of course, anytime folks have information and want to get better connected with Oregon's 988 call centers, we can help facilitate that. But in an ideal world, how do we make sure that every one of these lines, a warm line, a county line, 211, all at least know about each other and know what the transfer process is. And I'll share to answer Gordon's question about if 988 transfers to a local crisis line, is it a warm handoff versus just switching for the person to wait on their own? It is supposed to be a warm handoff, and we do know that there have been instances where that experience has not gone well. And I appreciate you, Gordon, for your ongoing advocacy and we will need everyone on this call and all of your partners to continue to advocate for this system to work how people in Oregon need it to work. So we can advance to the next slide there. And we can go to the next slide, and then we're going to play a little video.
Just, I'm gonna make sure. I'm double clicking it, Dean, and it doesn't like me.
Oh no, let me drop a link into the chat and we can watch it directly on YouTube. Sometimes, the...
Oh, it's a privacy thing. It's not. That's why it's yelling at me.
Yeah. So let's try.
Okay, you go there.
If you or someone you know is struggling or
Okay, just make sure. Okay. If somebody could let me know if the sound doesn't work when I press play, but I will press play.
if you or someone you know
Working.
is struggling or in crisis, you can get help by calling 988.
You've reached the 988 Suicide and Crisis Lifeline. Para español, marque el número 2.
When you call 988, you will hear a pre-recorded message before you are routed to a local 988 call center based on your phone's area code.
To talk with a counselor, stay on the line or press 0.
988 offers options for specialized support for veterans, service members and their families, and LGBTQIA2S+ youth and young adults. People who are deaf, hard of hearing, or prefer using American Sign Language can connect directly with a trained 988 counselor in ASL through the 988 video phone.
No matter who you reach, you receive free, confidential, emotional support by a counselor trained to help people in distress. They can also offer resources to assist in helping your loved ones.
Help is available 24/7. Don't wait to reach out. Call or text 988 or chat online at 988lifeline.org. You are not alone. Thanks for sharing that, Jen. So while we get the presentation back up, we had just updated that video. Folks may have seen it when we first published it last year. When we originally made this video, we wanted to make sure people understood that when you first call 988, it isn't just a ring and you talk to someone. And especially for people who are in crisis, that can be very concerning and challenging. The federal government did a lot of user testing and got feedback, and it used to be that it was a 45-second pre-recorded message, and they've cut that down a little bit and added a new press 0 option to skip that message. But the important thing that we also wanted to highlight in that video is, again, those specialized support services that, while not answered locally in Oregon, veterans can access the Veterans Crisis Line. There's a Spanish direct line by pressing 2 or texting the word Ayuda to 988. And then there's an LGBTQ+ for youth and young adults by pressing 3 or texting the letter Q to 988. With that, I'll come back in a second, but Rose is going to talk a little bit about the national network and clarify a few things.
Thank you so much, Dean, and thank you for presenting the video. I think our theme for sort of the last few slides of our presentation today is what should y'all know about the 988 network, about the experience of calling, the video we just saw, about the way the network operates, and then soon we'll talk a little bit about what y'all can do to be engaged. So I think that example of the venue options is actually a really great segue into what the national network is and what it offers and what it has been doing better and better as time goes on. So 988 operates via a system of 215 plus, it's growing every year, participating Lifeline centers. So that's who Northwest Human Services and Lines for Life are in terms of the network. They are participating members, and calls are routed across the network right now using area code. So in your phone number, you have the first 3 digits, that's your state, in the middle, that's your county, and calls are connected by county based on your phone number. We do expect improvements in this routing technology over the course of the next year, so we can talk a bit more about that in the Q&A. But just know that the network is extensive, and that is how calls are connected currently. In terms of what the network offers, again, the quote descendant of the National Suicide Prevention Lifeline, the network offers infrastructure directly to centers with training, quality assurance, technical infrastructure, as well as overall monitoring and evaluation of service outcomes. When people reach out in crisis, are they being served? Do the outcomes support the service being offered? Can the service improve? These are the types of questions that are constantly being asked and answered at the national level, and with collaboration and coordination among centers as various network members work to develop best practice. Research and development is a major goal of 988 right now. And beyond it, marketing and awareness to help people across the country and in Oregon know that the network is there, how to connect, and generally let people know that 988 is out there to offer support. There are 2 additional benefits that having a larger network structure provides. One is there is a national backup line for any call that rings longer than 2 minutes. Rather than waiting at the local center for the next available person to answer, those calls will automatically connect with a backup network and be answered so that the call isn't left waiting. This is a benefit too of having the network using, the same principles of training and quality assurance, et cetera, is no matter which center answers, excuse me, it will be a similar quality of service. And then the network also offers specialized lines, which we have hinted at here and there throughout our presentation, but I'm going to pop this back over to Dean to talk a little bit more in detail about what those services look like.
Perfect. Thanks, Rose. Yeah, we can go to the next slide, Jen. So we mentioned these in the video, but again, especially as we start talking about communication resources, know that there are a lot of national resources to help promote the Veterans Crisis Line, which is dialing 988 and pressing 1, reaching a trained crisis counselor in Spanish, which is calling 988 and pressing 2, or texting the word Ayuda to 988. For queer youth and young adults, folks can call 988 and press 3, or text the letter Q to 988, and a network of specialized support, which includes the Trevor Project and other affirming LGBTQ plus counselors can provide that direct support, which we know is desperately needed. And then this fall, American Sign Language video phone became available. We can go to the next slide. So what can folks do? You all already are doing everything you need to be doing, asking questions about 988, working to understand 988. We know it is an incredibly complex system. It does not help that it's routed by area code, not geo-routing right now. And it has been challenging to get clear, consistent information across the nation. We'll drop this link into the chat so that everyone has it, but SAMHSA, the federal government, does have a pretty decent social media and other partner toolkit. We do know that ordering materials is extremely slow, but you can get stickers and posters and magnets And there's some really nice content that the federal government has created, and they're doing a better job of creating more content in Spanish, and as well as reaching priority populations. And yes, thank you, Jill. Those resources are for free. As challenging as they are to order and as long as they may take, the fact that they don't have a bulk ordering system yet, we are frustrated with, but anyone can go to what's called the SAMHSA store and get free 988 materials. And if we go to the next slide, until we have Oregon's 988 communications campaign, want to make sure everyone knows that the state of Oregon has no concerns whatsoever with any community partner using their own information or national information, or of course, reaching out to us for any support on messaging about 988. We did finally hire a strategic communications and marketing vendor, and we are in the early stages of coming up with a strategic communications and community engagement plan, which will guide our first year of an upcoming 988 awareness campaign. As we'll talk more in the Q&A, there's been lots of misinformation. How we talk about 988, do we talk about suicide? Do we talk about mental health? Do we talk about behavioral health? What are the barriers that folks need to move past to even consider talking to a stranger or calling or texting? We know all of these are going to factor into exactly what Oregon's 988 communications campaign looks like. So we have done a first round of community partner interviews. We do know that coming to the full alliance is in our plans, because you all have incredible connections in every single county. But just wanted to share a little bit about some of the partners you see on the screen that we've heard some early insights from, and happy to do in-depth conversations with any folks about our marketing campaign, but we'll save time for Q&A. We can go to the next slide. Perfect. And feel free, Jen, we can take the slides down. I'll drop these emails into the chat. And we'd love to go through any and all questions and answers.